Hello and welcome to the Community Analysis presentation for Safety Harbor, Florida. The objectives of the presentation are to provide a historical overview of the City of Safety Harbor and a community analysis which will include areas such as population structure and health-related resources. The presentation will also consider 6 prioritized community problems as well as a community issue perceived globally. In the early 1500s, the original settlers of Safety Harbor were known as the Timucuan Indians. The Timucuan Indians were well known for erecting ceremonial mounds for their dead as well as mastering the crafts of pottery and art. As the territory developed throughout the centuries, the area became an important harbor and boating safe haven. The city of Safety Harbor was formally integrated as a city in 1917 with a population of 200. Accordingly, the 20th century was a time of growth and prosperity for the territory, utilizing natural landmarks such as the 5 natural mineral springs within the area to promote industry and tourism. It is interesting to note that the population census for Safety Harbor has had a 2% decrease in recent years. The 2000 census reported a population size just over 17,000 citizens, while the most recent census reflects a population of 16,844. This could be attributed to the geographical limitations imposed upon the area, where the city is surrounded by neighboring communities such as Palm Harbor, Tampa, and Clearwater. Additionally, real estate and property taxes are expensive in this area due to its unique historical attributes. During my windshield survey of Safety Harbor, it is apparent that the city relies upon the older historical houses and structures to promote industry. Newer houses are being constructed amongst older ones, including the construction of subdivision neighborhoods. There are 8,241 housing units within Safety Harbor, with over 5,500 owner-occupied, 1,635 rented, and about 835 vacant. There's a federal funding program available for low-income housing designated for individuals that earn less than 50% of the area mean income. Additionally, organizations such as Pinellas Safe Harbor are available as an emergency service for the homeless in the Pinellas area. It is interesting to note that only 24% of the Safety Harbor population has graduated from an institution of higher learning, compared to a state average of almost 29%. However, 13.8% of the population has achieved a master's degree or higher, while the state of Florida compares at 9.5%. During my windshield survey, help wanted signs could be observed at local convenience stores and gas stations. Unemployed persons in Safety Harbor were calculated to be 4.3%, while country and state numbers were slightly higher at 4.8 and 5.1, respectively. When conducting interviews with various residents, it became apparent that heart disease was a major issue in Safety Harbor and Pinellas County. Residents reported the cost and utilization of heart-related medicines and therapies within skilled nursing facilities in everyday households. Heart disease is among the leading cause of death nationally and within Pinellas County. Heart disease is also considered to be the #1 cause of death within the state of Florida. Accordingly, this can be considered a common healthcare issue among communities in the United States. Safety Harbor is relatively small in comparison to other communities, thus the space for larger structures such as schools is restricted. However, within the limited space, there are a total of 14 care centers and schools. There are surrounding community high schools, including Countryside High School and Palm Harbor University, as well as St. Petersburg Community College. The city also offers learning centers such as the Florida Sheriff's Youth Ranch Learning, a resident and summer camp program that offers reformation for delinquent behaviors to youth with unique living situations. Upon interviewing several parents at the Montessori School on McMullen Booth Road, general consensus suggested that schooling was more than adequate in the area. However, one particular issue arose was the cost of care. Safety Harbor provides a number of educational resources in order to promote literacy among the public. The Safety Harbor Public Library offers several services to promote education among its residents, including story time for babies, toddlers, and preschoolers, social seniors for the elderly, teen time, family movie night, and arts and crafts. In addition to this, many churches in the area host numerous events providing outreach programs and education to the community. One aspect of the community that is particularly unique compared to the surrounding communities is the historical and cultural perspective offered throughout the city. The pride that is felt in the community due to this particular feature is evident in the well-kept conditions of the older buildings and structures in downtown Safety Harbor. Creating and sustaining a healthy lifestyle is an unmistakable priority in Safety Harbor. Many of the areas throughout the city have trails for running, jogging, walking, or biking, as well as playgrounds, gyms, pools, and recreation centers. Philippi Park offers additional amenities such as boating, water sports, and fishing. The facilities cater to all age groups and include handicapped accessible parking, restrooms, and ramps. In addition to this, the surrounding area of Pinellas County offers preserves such as Brooker Creek. Many areas are low in cost, allowing the majority of the community and visitors to participate. The City of Safety Harbor is patrolled by the Pinellas County Sheriff's Office, providing law enforcement services through an annual contract. This is dissimilar to the surrounding cities that are patrolled by city agencies such as Clearwater Police Department. The Pinellas County Sheriff's Office provides a variety of programs that involve members of the community in an attempt to create a safer, well-educated community. The fire station in Safety Harbor is centrally located in downtown Main Street, and it's comprised of a primary response unit and a reserve unit, while also operating a marine unit for water emergencies that is unique to this area. Meese Countryside Hospital is the only hospital directly in the Safety Harbor area. However, Safety Harbor is sandwiched among larger communities with a number of hospitals and acute care facilities. Pinellas County offers a public health department that is available to its residents, offering services for all levels of care and all ages. There are a number of skilled nursing facilities, assisted living facilities, and nursing homes in the area that provide numerous services 24 hours a day. Government-funded institutions such as the VA are not directly available, and most of the skilled nursing facilities are relatively expensive. When interviewing a resident of Safety Harbor Senior Living, it was apparent that certain services were excessive and many residents required additional funds from family members. Despite recent improvements in medicine and technology, over 1 billion people lack access to adequate health care. Poverty is a key element behind the lack of access. Studies have shown that people who have the most access to health care are the people who have the least need for health care. In an attempt to provide more accessible health care, Healthy People 2020 has included this as one of their topics that need to be addressed. Health inequalities can be found not just in poverty-stricken countries, but in wealthy nations such as the United States. The World Health Organization has recently begun an initiative to actively strengthen its role in providing comprehensive, cost-effective quality health care. Strategies include strengthening the capacity of WHO to integrate a human rights-based approach to health and advancing the right to health in international law development. The City of Safety Harbor functions under a commission manager form of government, commonly referred to as council manager government. The council incorporates legislative direction, and the city manager is responsible for everyday administrative processes. Residents can contact officials directly by phone, email, or private meetings. Additionally, Pinellas County is made up of the Pinellas Board of County Commissioners. The board will usually meet twice a month on the first and third Tuesday, and residents are invited to attend all meetings. If unable to attend, minutes are made available through the website. During my windshield survey, it became apparent that cigarette smoking and the effects of secondhand smoke is a prevalent issue in the community. Cigarette butts and tobacco products were observed in parks, downtown centers, and other community areas. The Center for Disease Control relays that more than 480,000 deaths occur annually, including deaths from secondhand smoke. Tobacco use is the number one cause of preventable deaths in the world, while the consequences of secondhand smoke includes disease such as lung cancer and chronic respiratory illness. The effects of unhealthy lifestyle choices can be observed in the number of residents frequenting fast food restaurants and the apparent inactivity among obese residents. Within Pinellas County, more than 63% of adults are overweight or obese, while approximately 29.5 to 33.5% of children aged 2 to 4 are overweight or obese. The physical environment in Safety Harbor is another issue. Upon observation, I noticed a number of drivers that did not yield to oncoming traffic or observe the right-of-way due to texting and driving, general cell phone use. Florida was recently graded the worst state in distracted or careless driving. A recent study suggests that teens are less than 6% of the population but account for almost 14% of careless driving accidents. Consequently, education should be provided on safe driving practice to help reduce the number of reckless driving. Ensuring that the community stays educated and up to date on immunizations for all ages is also important. Recent numbers in Pinellas County relate that influenza and pneumonia-related deaths are higher than in other counties. Providing easy access to the influenza and pneumonia vaccine, especially to older residents, can be accomplished by advertising convenient locations such as Walgreens, CVS, and various walk-in clinics. When observing the community, I did notice certain disparities among the different neighborhoods. Trailer parks were located near or around upper middle-class neighborhoods, and I observed homeless residents among parks, convenience, and liquor stores on several occasions. Unemployment has become an increasing concern for Pinellas in recent years. 2011, the Pinellas County unemployment rate was greater than the national unemployment rate. To combat this problem, the Florida Department of Health in Pinellas County is offering routine medical and dental services to children, teens, and adults living below the federal poverty line. Advertising resources such as this are important steps a public health nurse can take to assist vulnerable populations. Diseases such as chlamydia, gonorrhea, and syphilis are notably higher in Pinellas County, with women aged 15 to 34 among the highest. It is important that the public health nurse provide education on the prevention of sexually transmitted diseases for all individuals who are sexually active despite their age. Despite recent improvements in medicine and technology, over 1 billion people lack access to adequate health care. Poverty is a key element behind the lack of access. Studies have shown that people who have the most access to health care are the people who have the least need for health care. Health inequalities can be found not just in poverty-stricken countries, but in wealthy nations such as the United States. The World Health Organization has recently begun an initiative to actively strengthen its role in providing comprehensive, cost-effective quality health care. Strategies include the capacity of WHO to integrate a human rights-based approach to health and advance the right to health in international law and development. Safety Harbor's website is easily navigated and provides direct links to services such as Pinellas County Human Services. The website provides direct links to government services such as emergency dental, medical, emergency financial services, mobile medical units, family housing assistance programs, and the Department of Children and Families, which can offer assistance with food stamps and medical bills. Community health nurses are essential as they have the ability to adapt to their surroundings and are willing to provide care in many settings, including community health clinics, churches, homeless shelters, and schools. Interventions such as developing wellness programs, administering well baby assessments, vaccinations, and newborn screenings are just a small sample of what a community health nurse can do to initiate access to health care. Conducting programs in free clinics and college campuses also helps address health care costs. Thank you. The end.